I'm a surgical oncologist, which means that I approach cancer patients from a surgical perspective, but I also am required to understand and utilize medical oncology, radiation oncology, and integrate all those things together. Within surgical oncology, we take care of many diseases. I focus on two. One is cancer of the appendix. It is a rare disease, and we see about 5% of all of the patients in the United States with non-carcinoid neoplasms of the appendix. The other disease I take care of is cancer of the stomach. And within that, I primarily focus on a group of patients who have what's called a CDH1 gene mutation. These are patients who have what's called hereditary diffuse gastric cancer. It is really important when you're dealing with a complex problem like cancer to have people who really understand and live with taking care of patients with this disease. Many of us have been dealing with this for decades and trying to understand the nuances for each patient. Having people who are expert in that specific disease can make all the difference in outcomes. I think one of the unique aspects of MD Anderson is that as a surgeon, I get to have a very different relationship with my patients than many other institutions. My colleagues and I realize that there's an entire patient there, a family, and people who need an education and an understanding and a oftentimes long-term relationship to help get them the best outcome. And I'm able to do that here. So that's probably one of the big reasons I've stayed here over the last 35 years. I'm Paul Mansfield, and I'm making cancer history.